This is Michael.
Aubrey.
Catherine.
Care.
We're here today to talk about management of wounds, wound care, wound dressings. I'm going to briefly talk about the different types of drains that we may encounter on the floor. The two most common types of drains would be the JP drain. It's easily identifiable because it has a bulb suction device at the end of it. This will collect body fluids. We can measure this as part of our INOs. When we empty it, you simply remove the bulb part, drain the contents, apply some pressure. So you're going to depress that bulb, then you're going to hook it back up. This provides gentle suction to help evacuate fluids from the wound. The other type of drain that we may encounter is known as the Penrose drain. This is easily identifiable as basically it's a flattened tube, and this will be sutured into the wound. And again, this allows a port for fluid to drain from the wounds. We may also encounter wound vacs. Those vary from different manufacturer, but they usually include some sort of foam and occlusive dressing as well as a vacuum device that again assists in drawing fluids from the wound and assists in healing.
I'm going to talk about the different kinds of dressings. There's wet to dry, colloidal, foam dressing, and then also just the dry dressing. Now wet to dry is more for debridement as well as the colloidal. Dry dressing is more like sort of like Band-Aid kind of thing. Just for the dry dressing. The foam is more for pressure ulcers, and that's all I got for the types of dressings.
Okay. I'm going to talk about your standard dry dressing. Like Aubrey said, it's more Band-Aid type. To change that dressing, you would remove using Clean Technique, gloves, that sort of thing, you would remove the old dressing. And then if needed, you would don sterile gloves for placing the new dressing on there. If that dry dressing is sticking to the wound, this is a type of wound you don't want to debride. So you would use something like sterile saline. There's spray bottles of that to spray to help remove that dressing without removing the patient's wound, the new growth on the patient's wound for its healing. Okay.
Okay. And I'm going to talk about wet to dry. Usually these are like for debriding and packing. What you would do is take the old stuff off with Clean Technique and then don your sterile gloves. You will wet your gauze with sterile saline, typically, and you would pack it be a loose packing, and then you're going to cover it up, and that's what you're going to do with that.
And then when it dries, when you remove it, it debrides the wound, it pulls out.
It debrides that, and also if they go in to debride more, it won't be dry. It'll be moist enough for them to go in and debride.
Mhm.
And that's what we have.
And of course, prior to doing any of these, we would verify the order, verify the patient, perform hygiene, as well as body substance isolations. Okay, that's a wrap.